Hello, everyone. My name is Worley Smith. I am the Guilford County Communications Manager. These are for all of our attendees. Just a few housekeeping items to keep in mind before we start. There will be questions following Chairman Alston and Dr. Van's COVID-19 update. I ask that you please use the raised hand feature once we start the Q&A period. We ask that you please limit your questions to one question at a time. If you still have questions following the Q&A session, please email me directly at wsmith2@guilfordcountync.gov. Again, that email address is wsmith2@guilfordcountync.gov. Thanks.
Let's go ahead and get started. Welcome. Thank you for joining us today. I would like to start off by asking our Public Health Director, Dr. Van, to provide us with a quick review of our current community metrics. Dr. Van?
Thank you, Chairman. I am going to quickly share my screen so I can provide a couple of dashboards to the that will be proven to be valuable to this conversation, and I found it now. You should be able to see my screen right now. So for the last few days, Guilford County has seen some of the highest numbers that we have seen throughout the entire pandemic. And this graph here, what we call a epi curve, you can see how starting the week of December 24th, we've started seeing a tremendous increase in the number of cases, higher than even the peak that we've experienced at the beginning of the year last year, with the majority of these cases being detected in the week of the Christmas holiday. This particular graph is also showing the progression of cases starting the week of May 8th of 2020. And these are weekly cases that are being listed here. So these are the weeks that we have experienced over the last almost a year now, including the week of December 31st. You can see that in the week of December 31st, we've had reported to us 3,531 cases, which is the highest number of positive cases that we've ever received, compared to the 2,844 cases that were reported in the week of February, the first week in February. And if we're looking a little bit closer to the last few weeks, starting the beginning of December, we can see how the numbers have also increased greatly during that week in December that I've just mentioned, compared to a plateau that we have seen at the very beginning of December for the first 2 weeks, where we were seeing anywhere between 150 to 200 new cases every day. Those cases have spiked at really high numbers, with one of the highest numbers, highest days that we've had so far at 893 cases during this time. We are also very concerned about our positivity rate. Right now, our 14 days average positivity rate that is being calculated on a rolling basis, it's at 18.9%. This is the highest positivity rate that has been recorded for 14 days. And when we're looking at our single day positivity rate for the last day that has been recorded, which was December 2nd, January 2nd, I apologize, we are at 32.3%. This positivity rate at a single day positivity rate has been above 30% for the last 5 days. So as we're going to see the 14 days rolling positivity rate, that is going to continue to go up, staying at approximately 30% for the next few days. This means that approximately 1/3 of all the tests that have been performed in our county have tested positive. This is in an environment in which testing has increased tremendously as well before the Christmas holidays, and continue to stay very high. This metric depends very greatly on the number of tests that are being performed. And at this point in time, because of how many tests that have been done in our community, we feel like it gives us a very good understanding of where community transmission stays. I'm also going to mention a few of the measures that our partners from the health care system shared with us over the last couple of days. At this time, Cone Health is extremely concerned and stretched very thin within their facilities. They are experiencing an increased number of people that are being hospitalized with COVID-19. They have over 200 individuals right now with that are hospitalized, with additional people that are being held before they're able to find resources for them. So we know that this number is going to go up even more. They also have a very talented team of modelers and projectors in their data analytics team that are showing some dire future numbers as far as hospitalizations are concerned. So in the next 14 days, we are expecting those hospitalizations to continue to rise. As I've mentioned before, we're seeing cycles in the number of cases. A week or two later, we're seeing increase in hospitalizations, and then 2 to 3 weeks later, we're starting to see the surge in the number of deaths that are being reported to us. So this is where we are right now, Chairman. If there are any additional metrics or information, I'll be more than happy to provide them after this briefing, and I'll be more than happy to answer any questions at the end.
Thank you, Dr. Van, for that information. As you all just heard, we are experiencing a significant surge in infections. These are more than just numbers. This data represents real people, our co-workers, our medical service providers, and our family members. In my role as chairman, I met yesterday with the mayors of municipalities that make up Guilford County, along with the vice chair, Carvina Foster, at-large Commissioner Kay Cashin, county public health and county leadership teams, as our medical experts and our medical experts at Cone Medical Center to discuss the recent sharp increase in COVID-19 positivity rates affecting our county, and more importantly, our available resources used to combat this daily pandemic. As a result of that meeting, I made the decision to issue a mask mandate proclamation under the authority of the current state of emergency. This new mandate will take effect in Guilford County at 12:01 a.m. tomorrow morning, January the 5th, 2022. And we reinstate the mask mandate for the unincorporated parts of Guilford County. Under state of emergency powers, I have formally asked the mayors of each municipality in Guilford County to sign on to this mandate for their jurisdiction. So far, we have the town of Gibsonville, the town of Sedalia, Pleasant Garden, and Jamestown. I urge all of the other businesses also in those municipalities who have not signed on as of yet to voluntarily reinstate masking in your buildings and in your businesses to help reduce the surge in this infection. While the county, in its role as the Board of Health, is prepared to consider a comprehensive masking mandate, the statutes require us to wait until January the 13th to do so. Due to the notice requirements associated with the Board of Health, we must rely on our municipal partners to help support this proclamation to address the immediate needs for mitigation efforts to slow down this urge. Until that time, we must take immediate efforts to address the rise in the numbers of COVID-19 positive rates in our hospitals due to the Omicron variant. The average number of people needing hospitalization for COVID-19 treatment has jumped from under 50 admissions in a community positive rate of 5% when our last mandate was lifted to an admission rate now over the last 3 days at Cone Hospital over 150%, and a countywide single day positivity rate, as Dr. Van just stated, of 32% as of Sunday. Cases of COVID-19 in Guilford County are rising and never before seen pace. due in part to recent variants of this virus, increased travel during the holidays, and the need for more people to become fully vaccinated and boosted. More people are getting sick and sick enough to be hospitalized. This surge is causing a significant impact on our essential resources, both public and private. Hospitals are now stretched beyond their limits in numbers of beds and personnel, and the personnel there that they have there to treat us is diminishing because they are contracting this virus also. We are once again seeing our medical community take mitigation efforts such as cancellation of voluntary surgeries, reinstating surge protocols, and emergency departments experiencing long wait times. County resources, public health, and EMS are also stretched thin. Businesses are losing productivities as workers become ill. In short, this is a crisis that needs our immediate attention. As elected officials, county and local municipalities alike, we have a responsibility to our citizens to ensure essential services that are sustained. It has become quite evident after listening to our local medical professionals that we are reaching critical capacity. It is our obligation to help mitigate this danger. We heard from those on the front line who deal with this all day and every day, tell us in plain talk that this current surge in COVID-19 positivity rate will peak within the next 10 days. So we must act now. Our very best mitigation effort at this moment is to return to a masking mandate. This is the most logical way to protect ourselves as well as protect each other. Unvaccinated individuals are twice as likely to acquire COVID-19 now, and vaccinated individuals may still contract and spread the virus, even if they have no symptoms. Until a high percentage of population is fully vaccinated, masking is the next best layer of protection to reduce the spread of the COVID-19 and protect those who are not eligible to be vaccinated. Over 95% of current hospitalizations for COVID are due for individuals who are not vaccinated. We all need to become part of this solution to protect each other and preserve our medical institutions' capacity to provide care. To this end, this emergency proclamation will take effect tomorrow for those within the county's state of emergency jurisdictions and for those towns who have committed to support emergency mitigation efforts. Information on this proclamation will be posted on our county website. Regardless if you are male or female, small town or large town, vaccinated or unvaccinated, Republican or Democrat, we are all one Guilford County. We all must continue to work together to overcome the impacts of this pandemic, and we need to do it now. Entertain any questions now that we have from the media, and you can direct your questions to me or Dr. Van. We also have Jim Albright, our EMS director, also with us that will be able to answer any questions that you might have in that respect. And Stephen Gross also with our emergency management team. Any questions? And please identify yourself.
Yes, it looks like I have one hand raised. Give me 1 second, sir. This is Lisa Lano from Fox 8.
Hey, Lisa.
Hello, good afternoon. This is Tyler Harden with Fox 8. Just a question in regards to enforcement of this emergency proclamation. Will there be fines right away for people who do not mask up?
Dr. Van, you'd like to take that?
Sure, and thank you also for Mr. Mason for being on the call with us, our interim county attorney, who's going to also help us with some of the questions. But we are going to take a very similar approach to the enforcement of the mask mandate, similarly to the way that we have done before. We have fines, so we have civil penalties that are involved in this. We're going to continue to work with the businesses and other entities to make sure that we're educating first. And then we're going to offer support and everything that we can to make sure that they can successfully implement the mask mandate. But we will also have the tools in our toolbox to issue fines in situations that we find that would be appropriate.
This is Tyler again with a follow-up question. For those people who have been fined in the past or have gotten a civil penalty, will they get a clean slate now for this new proclamation, or will they continue to get fines if they do not adhere to the emergency proclamation?
I will let Mr. Mason answer that question. I feel like it's more of a legal question.
Yeah, thanks, Dr. Van. And yeah, this is a new declaration today. Contemplated Board of Health rule on the horizon. That one obviously is not in place and would have to be voted on. Both of those are new. The old ones were rescinded. These are being put back in place, so we're starting anew.
And again, this is Tyler, just with one more follow-up. Just to clarify, this emergency proclamation will be until the 13th, correct?
That's correct.
Okay, our next question is coming from Grace Holland with WFMY.
Hey there, guys. Grace Holland with WFMY here. Just wanted a clarification. Chairman Alston, you had said that this proclamation was for unincorporated areas of the county. So does that mean that cities like Greensboro and High Point aren't included, or will they be included in this one that goes until the 13th?
They will not be included because, again, they, as mayors of the city, the mayor has to sign on to this proclamation for those cities to be included. The only cities that would be included at this point that have signed on thus far is the town of Gibsonville, Sedalia, Pleasant Garden, and Jamestown. But we're hoping others will join us.
Okay, our next question will come from Richard Barron, News and Record.
Hey, I had to unmute. Can you hear me?
We can hear you.
Okay. Mr. Chairman, I have a question about Mayor Nancy Vaughn, who has told the City Council that she would be unable to sign on to the proclamation until the county can provide some enforcement assistance to the city for the mask mandate. Is that something that you all would be able to rally between now and the 13th?
We will be able to enforce this as of tomorrow. We have our folks ready to go. We will be able to enforce it. If the city, if we were to pass the mask mandate as a health board on the 13th, then we would even bring even more people in like we did before. So we've done this before. It's not like we haven't done it before, and we will be doing it again just as effectively. So that's not a problem that they should have.
All right, thank you.
Next question.
Hi, this is Tyler Hardin with Fox 8 again. I just was curious, Chairman Alston, as far as enforcement, when you say you have people who are ready, well, how many people are ready, and then from what departments are they going to be coming from, and have these people been trained in regards to enforcement?
Dr. Van, you'd like to take that?
Yeah, sure. I'll be more than happy to take that. So throughout the pandemic, we've been able to really scale up and scale down our team depending on the need that we had. So we continue to have enforcement officers as part of the team. We still have some of the same team members that we had over the summer and into November that were doing this type of work still with us as part of our team. So as the chairman mentioned, we are not looking right now to really bring in new people and train new people. We're basing our response with the same resources that we've had before. So that's why we can move really fast on this.
Next question.
Again, if for all of my attendees, if you could use the raised hand feature, I will call you to ask your questions.
Anybody else raising their hands?
Yes, sir. I have a question again coming from Grace Holland from WFMY.
Okay, Grace.
Hey, Chairman. Just wanted to ask in regards to the meeting that you guys have on the 13th, where you will be considering maybe extending this mandate. What do you think the likelihood is that that will go through? And would that include more cities than this one does potentially?
I am not going to project one way or the other. That would be based on the individual considerations of our council, our commissioners being in the capacity as health members at that time. They would get this information, they would analyze it, and they would make the decision at that particular point. Once if it is passed by the health board by a majority vote, then it would affect all of Guilford County, all of the municipalities, including Greensboro and High Point and the other incorporated areas. So that would be an entire Guilford County health rule.
Okay, I believe we have a follow-up question from Grace.
Sorry, I just forgot to pull my hand down. Thank you.
Okay. We have a follow-up question from Tyler Harden with Fox 8.
Okay.
Dr. Van, this is a question that Lori passed along. Earlier today, you talked about the 3-layer mask. We were curious, is the health department going to give away any free masks once this emergency proclamation goes into effect for people who would need them?
So we've actually had conversations about this just yesterday. We're trying to find out exactly what the logistics are going to look like. And of course, Stephen is going to be a huge part of that conversation. But we don't have all of the details in place right now, but that is going to be a pretty high chance that we're going to be able to do that.
Looks like another follow-up question from Tyler.
I was curious, Mr. Chairman, what is your message to the mayors that have been resistant in signing on to this emergency proclamation? What would you want to share with them?
Well, I don't really know exactly what the hesitations might be. It can't be based on facts and needs. When you have the president and the CEO of Cone Hospital to come before the mayor's group like she did yesterday and tell them that she needs our help, then that within itself is alarming. For her to say to us that she can't take any more patients into the emergency room and they're lining them up down the hallways because they don't have any room for them. When she sounds the alarm that by the end of this week, we're probably going to be hitting our peak and it's going to get worse before it gets better. I can't see them basing it on facts. It might be politics, but it's a situation like I told them yesterday. We have to put people before politics and people before party. I think some of that is playing a part of it, unfortunately. But we will move forward with what we have at this moment. And hopefully they will jump on board. Many of them spoke yesterday in favor of doing something, but they did not give any recommendations in that respect. So I'm hoping that, and again, like I said in this message here, I'm hoping that the business community, they don't need the mayor, they don't need me, they don't need the politicians to tell them what to do as far as the right thing, as far as their business. They know that this virus is rampant. So I'm asking them to take control of their own businesses and put mask signs up in their places, and require their employees to wear face masks, and require their customers to wear face masks, not only for themselves, but for someone else. So I don't know specifically, but I can only imagine that I think politics has a great deal to do with that, not based on facts and need. Other questions?
I don't see any hands raised, sir.
All righty. I guess that would be it. If you have any follow-up questions, feel free to give us a call, and we'll be able to try to answer those questions at that particular time. And thank you all for getting the word out. Again, this will go into effect at 12:01 tomorrow and last until January the 13th. And we will have our health board meeting at that particular time to see what the will of the health board might be. All right, thank you again.